Good morning to you. 'Tis the season for turkey feast, but no one wants to look like a turkey. Here to explain how to get rid of your gobbler is our friend. Are we talking about this, Dr. Chaffoo?
We are talking about that.
That turkey neck.
Exactly.
Good morning. Good morning. Good morning. How often do you hear of people complaining about this?
I think, Shally, we see it more commonly now because I kind of call it phone face because we're all on either FaceTime or Zooms, we're looking at our phones or seeing our images. And so it's a common aging sign that occurs. One of the earliest signs of aging actually can be changes in your neck contour or loosening of the neck.
Okay, so this turkey neck, and I've noticed it too with the phones, because you look down and I'm like, wait a minute, what's that line going across my neck?
Sure. So the aging process obviously is three-dimensional. The first area that we begin seeing aging is in the skin itself. You know, like we said before, we lose elastin, we lose collagen, the skin gets a little, the complexion isn't quite as good. So for early changes like that, you can use skin products. You know, I brought a couple things. You can use products like alpha hydroxy acids or glycolics to help. They do work. The retinols, obviously, they over time will help with. But that's early changes. I think that by the time I see patients that have really had a significant change in their neck, it's not just the texture of the skin. The skin's become quite loose. And more importantly, what's going on beneath the skin surface. You can see this is a patient that had, a few patients have had neck lifts where we're working not just on the overlying skin, but the underlying muscle, the underlying fat under there to really tighten that, to reshape, to create a more neck contour. And oftentimes, Shally, these can be done through a hidden incision underneath the chin, no other incision.
Oh, really?
Yeah, it depends how much loose skin there is, but in early aging, oftentimes you can do this as an office-like procedure under local and work on tightening those muscles.
Expensive to do?
So it depends. I mean, it could be several $1,000s depending upon how extensive the procedure is. If it's a more extensive procedure where we'll go to an outpatient center, then there's a cost of OR and anesthesia as well. But it really makes a huge impact for people because it really just creates that sharper jawline. Part of the other thing that we see is as we all age, we begin to lose volume, fat in our faces. We begin to have some sagging of the actual bone resorption. So in some cases, we'll add fat or we'll add a small implant to create a stronger jawline. So there are a lot of things that can be done. First of all, you have to diagnose it, figure out the problem, and then correct it from there.
Do lasers work?
Lasers work more on the face. And so yes, you can use, for example, Fraxel laser, we use that a lot. That's really more for textural changes, if you will. You can't use the lasers aggressively on the neck as you can on the face because it does not heal as well and it's less predictable.
Okay, so final piece of advice is we're talking about turkey neck right before the turkey day. What can you do if this is an issue for you?
I think the thing is making sure, get in to see a surgeon certified by the American Board of Plastic Surgery and get a consultation, get an evaluation. I mean, we see a lot of stuff online. I'll have patients who will come in, but there's as much disinformation as there is information. It's really hard for the average person to navigate the healthcare system. So get in, get a consultation and see what your options are.
Good advice. And I try to do my phone. Lift my neck and do it like this. Thank you, Dr. Chaffoo.
Sure.